Hello viewers, you're welcome to our enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Ubong Ekpene, a consultant neurosurgeon with the University of Uyo Teaching Hospital in Uyo, Akwa Ibom State, and a lecturer with the University of Uyo. In our last video, we had considered one of the types of intracranial infections as a cause of secondary headache, and that was meningitis. And today we are looking at another type of intracranial infection that can cause secondary headache, and that is brain abscess. Brain abscess has to do with an infection of the brain that leads to a localized accumulation of pus within the brain tissue, within the intracranial cavity. When this happens, the patient may develop symptoms that are traceable to the part of the brain that is involved. What causes this abscess could be caused by a bacterial infection, a fungal infection, infection by causative agent for tuberculosis called Mycobacterium tuberculosis, by some protozoans, some microorganisms, also like Entamoeba histolytica. These are all factors that can give rise to brain abscess, and there are many others, but we'll limit ourselves to just a few. How does a patient develop this condition? When there is an infection of the spaces close to the brain, like ear infection that is not properly treated, sinus infection. Sinuses are spaces that are around the head and the face. When those spaces are inflamed or infected and are not properly treated, they can track infection towards the brain and infect the brain. Tooth decay, problems with the eye, poorly treated eye infection, all of these can predispose to development of brain abscess. Could also occur following a head injury in which there is a breach in the layers of the head that opens up the intracranial space, allowing for microorganisms to track down into the intracranial space, leading to infection that ultimately can cause a brain abscess. Also, poorly treated meningitis can be the beginning of a formation of the brain abscess. There could also be infection or brain abscess that results from hematogenous spread. Hematogenous spread means that you have infection far away from the brain and it is now transmitted through blood to the brain. If somebody has immunosuppression following HIV infection, or the patient is a diabetic or is on steroids or drugs for cancer, or the patient has undergone organ transplant and is on immunosuppressive agents, this reduces the patient's immunity, and infections from different parts of the body can track down to the brain, eventually settling as brain abscess. It could also occur following an infection that affects the patient following a surgical procedure in the head. If somebody has undergone a brain surgery, this can also predispose, if not properly managed, to development of brain abscess later on. It tends to be commoner in males relative to females. How does a patient who has brain abscess present? One of the symptoms is headache. And the headache could be mild or it could be severe, depending on the size of the abscess. You may also have associated fever that may be low grade or it could be high grade fever. Patients could also have seizures, convulsion, that may manifest with shaking of the body, clenching of the teeth, biting the tongue, rolling the eyes. Patients may also have fecal incontinence, urinary incontinence while this is happening. It could also result in weakness of one side of the body manifesting as stroke, depending on which part of the body that is involved. Sometimes the neck stiffness may have caused the patient to have altered consciousness, drowsiness that eventually may lead to coma and even death. It is an emergency and must be treated if the brain must be saved, and also if the life of the patient must be saved. How can this patient be diagnosed? Based on the symptoms that we have mentioned and the history of probably previous ear infection, nasal infection, sinusitis, eye infection, tooth extraction or infection, all of these may be pointers. Head injuries in the past and other symptoms we've mentioned or the risk factors we've mentioned would be signalers to the fact that that may be what we're dealing with. Patients would also require a scan of the brain. It would be an MRI of the brain or a CT scan. This would show features that may suggest that the patient has this condition we are describing. Other investigations may require taking blood samples and other assessments. Most important thing is that once it is confirmed that the patient has brain abscess, it must be treated with urgency, because time is brain. An infection of the brain is a serious infection that, if not handled properly, can have lifelong consequences that can either mar the patient's life or even lead to death. That is why it's important that prevention is key. What should be the preventive measures taken? If you have an ear infection, you have sinusitis, you have eye infection, you have a tooth decay, you must ensure that it is treated properly at the appropriate place in a hospital. It is not to self-medicate, because if it is not properly treated, it can lead to more serious complications that can affect your brain. It is also important that if you've had head injury, or you notice that water is leaking from your nostrils, that is clear fluid testing salt-like, or you are on any of these immunosuppressive things that we're talking about, drugs that we're talking about for cancer, diabetes, for transplant surgery, all of those, you are at higher risk of developing this condition. So it's important that at the earliest manifestation of the symptoms that we have mentioned, that you must present to the hospital for urgent treatment, because urgent treatment can be not just brain-saving, but life-saving. You can share these videos with your friends and other groups if you like, and ensure that you keep yourself from risk factors that can predispose you to developing this condition. Thank you and have a blessed day.